Hello all, I am Dr. Avinash, Consultant Pulmonologist at KIMS Hospitals, Kondapur. I was asked to talk about fungal pneumonias or fungal infections. Generally, we as pulmonologists encounter fungal infections in immunocompromised, like patients having CKD, CAD, coronary artery diseases, malignancies, and of course chronic airway diseases like COPD or asthmatics. And generally, we encounter fungal infections in patients who are not responding to the treatment of routine respiratory tract infections, including pneumonias. So even non-responding pneumonias and non-resolving pneumonias, wherein we give treatment, they get better, but even after 2 weeks or 4 weeks, there is no radiological resolution. Then we have to think on the lines of fungal infections, which we have been seeing. Say out of 10 cases of routine infections, 1 or 2 turn out to be fungal infections. And out of the blue, we see even from the normal patients, at times we are seeing, and also from immunocompromised patients. Coming to the diagnosis part, generally we send the sputum for culture. It may or may not be representative at times. So we advise bronchoscopy and we do bronchoalveolar lavage, send it for fungal cultures, wherein we get the cultures, and simultaneously we will also be sending beta galactomannan and beta D glucan in the bronchoalveolar lavage, which detects the presence of a fungal cell wall. Also, there is an RT-PCR technique called the mycopanel or panel, which detects the genetic material of all the fungi. So these 3 tests we will be sending depending on the suspicion we have in the patient. And of course, really we go with the biopsies. Sometimes we go with biopsy and they turn out to be fungal infections. As pulmonologists, small point regarding aspergillus infection, wherein it colonizes the respiratory tract of the chronic airway disease patients, and it forms something called ABPA, allergic bronchopulmonary aspergillosis, wherein it's just a colonization, but it doesn't cause any invasive infection, which has to be, of course, treated with antifungals and steroids, and which is a commonest entity in chronic asthmatics, which is usually missed and treated as poorly controlled asthma. Thank you.